Some people say that focusing on social justice through cash transfers is a really ambitious ask, but actually if you look at work that's been done through the MDGs and other cash transfers to date, what you see is that this focus on economic empowerment and on access to services, it's limited in terms of its impact on people's lives. It's only gone so far. People really haven't been able to develop the kind of resilience they need to lead a life that realizes their full human potential. So really what we've got to do is make sure that we're also thinking about the other types of vulnerabilities, so social and psychosocial vulnerabilities that impact people's well-being. So if we think about children, then they might have access to school, but if they're facing domestic violence in the home and aren't getting the kind of support and nurture that they need, then they're not going to realize their academic potential. Similarly, people with disabilities, they might have access to healthcare or to support at home, but if they're then discriminated against in the community, then once again they're not going to realize their full potential. So that's why this focus on social justice is so key. Our work has highlighted a number of different implications, but I'll just give you two examples. So the first is that often people say that cash transfers are being crowded out if we're asking them to deal with social vulnerabilities, with psychosocial stress, and also with economic empowerment, that it's too much for one program. And I think clearly that's true, but cash transfers do need to be designed so they're thinking about the broader range of vulnerabilities that people are facing, and then to link up to complementary programs and services. So they need to be referring people to, for example, legal aid if that's what they need to deal with intra-household violence, or access to credit if the cash transfer is not enough to make ends meet. But similarly, many cash transfers, they have these education and citizen awareness raising initiatives. So there too, they can provide people with information about, okay, if you've also got these issues to deal with, then here's an NGO-based service or a faith-based service or another government department who might be able to help you. So there's a way that they can reach out to people. So I think that's key. In terms of implementation, then another critical implication is thinking about capacity building for the implementers. So often you have these great designs that have been dreamt up by people sitting in capital cities, or maybe even London as we are, but not really thinking about how we're going to ensure that the people at the grassroots level actually know what the design says and what its practical implications are for their day-to-day ways of working. So they really need to know what it means to work sensitively with people with HIV, as some of these people in our exhibition are part of programs dealing with HIV, or people with disabilities, or older people. Yes, there's a really nice example from India. So you might have heard about the National Rural Employment Guarantee Scheme. This is a huge program that's now reaching 50 million households in rural India. And what the program does is it provides people with 100 days of work at minimum wage to ensure that they don't fall into absolute destitution or extreme poverty. And what's key about this program is that it's been legislated as a right. So people have an entitlement to go to their local authority, and if they can't provide them with work, then they can demand this wage, the equivalent of 100 days of work. So that's critical in terms of ensuring people don't think it's a gift, that it really is something that they deserve as citizens. But what's more exciting about the way the program's been designed is they've set up something called a social audit, which means that every 6 months or a year that communities who have participated in the program, they sit down with the implementers and they talk about what's working and what's not. So this is a great way to ensure that the program is more responsive, can really meet very locally specific needs, and also that the programmers have an idea of what they can do to enhance their own work and effectiveness. I think donors, if they really want to ensure that cash transfers achieve social justice, they should focus on at least two key things. The first is that often programs are started with a kind of one-size-fits-all sort of mentality, but actually what you've got to do is to undertake a comprehensive analysis of the types of different vulnerabilities and poverty experiences that people have. So women obviously have quite divergent experiences of poverty to men. They've got greater care burdens, they're more likely to be discriminated against in the labour market, often have greater risk to personal security. So there's a whole range of things that exacerbate their experience of poverty. And the same can be said for whether it's people with disability or HIV or older people. So I think that's absolutely critical. It sounds really basic, but very, very few designers, when they start out, take the time to go and talk to people and find out what their experiences are. And as you can see from this exhibit, there's a whole range of different experiences that even in the communities we talked to in Kenya and Mozambique, even those individuals had very different takes on what poverty or vulnerability meant to them. And the second key area that I think donors really have to invest in, but it's still a very new area, is providing spaces for program beneficiaries to participate in monitoring and evaluation processes. So at the moment, there's huge amounts of money going into very large-scale quantitative surveys. And they can tell you a lot of very important information, especially about the accuracy of targeting, and then impacts on who's crossing the poverty line, etc. But if you really want to understand what's happening to people's lives and their understanding of whether they're reaching their full potential and having improved well-being, then you've really got to go and ask people themselves. So I think finding spaces such as the social audit from India that I mentioned, or even just setting up booths on payment days. So at the bank or the post office when people go to get their cash, talking to people there about what's working, what kind of challenges they face within the household and within the community. Only then will you really understand how these small amounts of cash are transforming people's lives, and also what else has to be done.